Good evening, everybody. Welcome to tonight's webinar. Coming to you from Columbus, Ohio. My name is Dr. Andy Feltz, and tonight we want to talk about the biophotonic scanner and why an optometrist would want to add this device into their practice, and what the advantages of that would be from a healthcare standpoint for the outcomes of their patients, and from a financial standpoint as well. I'm an optometrist in Columbus, Ohio. Graduated Ohio State in '95, so I've been practicing for over 20 years. And about 20 years ago, I founded a mobile healthcare company, and I now serve as the clinical director for 360 Care, which is the largest mobile healthcare company in the U.S. I've been working with HCPN Alliance for about a year now, and have had the privilege of helping other healthcare providers add the scanner into their practices and seen the profitability and the patient outcomes. So it's really exciting stuff. Tonight's agenda, we're going to talk about macular degeneration, how carotenoid supplementation is the standard of care, how the biophotonic scanner is the best way, in our opinion, of evaluating carotenoid levels, and also a nutritional approach to other conditions like glaucoma, dementia, etc. Why Pharmanex is the best company to be positioned with in this space, and a simple practice integration system that we've developed, and how it helps create cash flow for a practice. So as optometry, we believe that, we always want to stay ahead of the curve from a technology standpoint. We want to keep our profession out on the cutting edge. And as you can see on the left, the biophotonic scanner is a really slick device. It's about the size of half of a football, so it has a small footprint. And it helps continue to push the envelope as having your practice, always having the latest and greatest technology. So macular degeneration is a devastating condition. It's the leading cause of blindness in the Western world. Having spent about 20 years of my practice in geriatrics, I have seen many severe cases, and it is really a devastating condition. So as optometrists, we know about lutein and zeaxanthin, how those nutrients are, ingested and then delivered via the bloodstream to the tissue in the macula. And the thing about healthcare and science is generally we measure things, we make some type of a recommendation or prescription or intervention, and then we would remeasure them. And when it came to nutrition, I've been talking to my patients for a long time about nutrition, and I never had a way to tell if they were deficient to begin with. That was objective, and I never had a way to remeasure to see if they were compliant, if they were actually taking my recommendations, and then if those recommendations were even working. Well, now we have this new biomarker. It's the only validated non-invasive antioxidant instrument, and it's objective. It has proven patient outcomes and proven practice revenue models attached to it. And we've been endorsed by Professor Jerome Sherman, who's at the SUNY College of Optometry. Also, Dr. Paul Karpecki has one of our devices in his clinic. And Stuart Richer, OD PhD, who's the head of the Ocular Wellness and Nutrition Society, also loves our scanner. So the heavy hitters in optometry have embraced this technology. Raman spectroscopy is the physics principle. It's actually old science, won the Nobel Prize in 1930. And it was been used in many applications, astronomy and also healthcare. Essentially, carotenoid molecules have these certain types of conjugate bonding that form an electron cloud around the molecule. And when blue photons hit that cloud, they resonate or vibrate and turn into green photons. And that can be measured. So the National Institute of Health and the National Eye Institute commissioned a study quite a while ago with the University of Utah and their biomedical optics laboratory. And they wanted to know if we could use Raman spectroscopy to evaluate for risk factors of macular degeneration. So a PhD physicist by the name of Dr. Werner Gellerman and his team of engineers worked on this device. Pharmanex did not have anything to do with this discovery. They are the company that bought the patents and then brought it to market as a commercially viable instrument. So the original device, as you can see on the right, was actually shining a blue laser into the macula, and then that blue laser, when it hit lutein and zeaxanthin, would change frequency into green, and they would measure that. They found it very difficult to administer the test, and they also became concerned about how many times you could actually run it on a macula, or how frequently you could run it on an eye and not damage the tissue. So they changed their focus, and they started looking at measuring it through the skin. And as you can see on that graph, they had really good results. So basically, they found that what they were measuring in the skin directly correlated to what was in the blood. So they felt really good that this could be an overall health biomarker, an oxidative stress test is what it did. Now we've kind of refocused on the eye. A paper that was published in 2017 in Investigative Ophthalmology and Visual Sciences showed that the objective measurement of the macular pigment done with a spectralis machine directly correlates to what we're measuring in the skin, and revalidated that this also correlates to what's in the blood. So the subjective methods that we see out there that only measure one eccentricity, not as accurate as the objective measurements that are available now. So we have a solution. Again, the NIH funded this device's development. Pharmanex is the company that has purchased all the rights and now brought it to market. It's quick. It takes about 30 seconds to run the test, so it doesn't mess with a practice's workflow. It's very easy to administer. Any technician can do it easily and quickly. As I said before, it's pretty small, so it fits easily in a pretest room, and it's also portable, so you can take it room to room as well. Very cost-effective test to acquire as a practice and to take as a patient. We'll talk about that a little bit more towards the end. Because the American diets are generally very poor and our food sourcing is inadequate, about 94% of Americans fail this test. And yet we see with intervention about a 99% positive response rate. So it really opens a great opportunity for you to talk to your patients about nutrition and to help them get better results. So now we can evaluate nutritional status. We can recommend full body nutritional products or eye focused products. Both are available through Pharmanex. And then we can reevaluate to show the patient positive results. Now let's talk a little bit beyond macular degeneration, because this device has application beyond just that one condition. And that's important. We know that cell membranes deposit these micronutrients or these antioxidants within it to help protect it against free radical damage. So the cell membranes of all of our tissues, need antioxidants. And the carotenoids especially deposit in the cell membrane layer and serve not only to neutralize free radicals, but they also act as signaling compounds to stimulate the cell to generate the intrinsic antioxidants like glutathione, so that we ramp up the production in when free radicals are bombarding our cells. There's a new study out about antioxidants and ocular perfusion in glaucoma. Basically, they showed that patients that took a antioxidant compound with omega-3 additionally, they had a decreased vascular resistance or increased perfusion in the ocular tissue of the retina, and they felt like this, was very beneficial to protecting that tissue. Have those retinal capillaries, more perfused and more oxygen-rich blood getting to that tissue. Dementia and Alzheimer's. We recently had Dr. Stuart Richer host a webinar for us, and I'd be happy to provide the recorded version to anybody that's interested in that. He's done a lot of research now on dementia and Alzheimer's. He's an OD PhD in the federal healthcare system up in Chicago, and he basically, goes through, quite a bit of research on the brain and nutrition, and he believes there is a dietary connection. And we should be checking all our patients for low plant food consumption, which is what the scanner does, and also for vascular disease. There's a link now between retinal vascular disease and dementia. And he also believes that eye supplements are likely to improve cognition, which is really exciting stuff. Breast cancer is not something that we're going to diagnose or treat, obviously, but it is kind of nice to know if we can help our patients reduce their risk. This was a 20-year study in the American Journal of Clinical Nutrition that showed that basically women with high plasma carotenoid levels had reduced risk for breast cancer. and particularly the more damaging, the more aggressive and fatal types. There was actually a study that used our device at the Cancer Center in Palermo, Italy, and post cancer surgery, breast cancer surgery patients in over 5 years, the higher the score on the biophotonic scanner, the less likely they were to have a recurrence or a relapse of their cancer. So that was very exciting to see our device used in direct link to post-surgical breast cancer patients. We know carotenoids are significant for all kinds of issues, cardiovascular disease, mortality in the elderly. We know about the eyes, lymphoma, HPV infection, in fact, rheumatoid arthritis, cognitive performance in the elderly. So carotenoids are very important for many, many diseases. So why would we want to get involved in making our patients healthier? Well, as a nation, our healthcare system is really unsustainable. We're at about 23% of our GDP now spent on healthcare, and people are sicker than ever. Cancer, heart disease, and diabetes, the incidence of those conditions continue to rise. And at the same time, we see physician income coming down, and people are just dissatisfied with the current state of affairs in our healthcare system. Life expectancy has declined now for 2 years in a row in the United States. Heart disease and cancer are still the number one and number two killers, and we know that most people don't eat right. They don't exercise well, and we still have many people who smoke. This is the more troubling trend, I think, and that is that as you can see, people that were born in the mid-30s at the time they were 65. About 9% of those people had some limitation in their activities of daily living. And people that were born 10 years later, by the time they turn 65, it's up over 12%, almost a 50% increase in the number of people that have reduced ADLs. So we're becoming sicker at a younger age and more disabled at a younger age than we used to. And that is a very, very troubling trend, in my opinion. So now we have a new opportunity to help our patients. According to the USDA, no one is getting optimal nutrition. Journal of the American Medical Association published a statement that all adults should take a multivitamin. According to the CDC, it's 50% of people are buying supplements. It's probably greater than that. And in the past, we've had no real easy way to measure its effectiveness until the scanner. The other thing is the supplement industry is unregulated by the FDA. So there is some bad actors, so to speak. The New York Attorney General just recently filed a cease and desist letter with Walgreens, Target, and some other retailers. They pulled some product off the shelves and analyzed it, and only 10% of the products that they looked at had the active ingredients in them. The Vitamin Shop has had not one, but 2 lead contamination recalls. And at the same time, we see the trend of money flowing into preventive healthcare and the supplement market. So it's now a $36 billion industry in the United States. It's quite a big, growth trend. So the critical questions come from your patients are, which supplement should I take, and how do I know if it works? Well, sadly, they're mostly buying it based on the label, the cost, a recommendation from a friend, or maybe even worse, they're going into a store and getting a recommendation from someone who's 19, 20, who's had maybe 2 weeks of training, and they'd rather have your opinion. So your patients trust you. They know you've studied the body. They know you take tons of continuing education every year, and that your understanding of the body and what it needs to function at its best is much greater than somebody that's again gone to GNC University for 2 weeks. Let's talk a little bit about Pharmanex. It's a company that was founded in 1994 by 3 drug developers. So Dr. Michael Chang was the director of medicinal chemistry at Merck, and he is actually the developer for Mevacor, which was the first statin drug. Dr. Joseph Chang, he was the inventor of Rapamune, which is an anti-rejection drug for organ transplants, and worked at Wyeth Labs. And then Dr. Carl Djerassi from Stanford is the inventor of the birth control pill. So these were heavy hitters in the pharma development and discovery world, and they kind of got fed up with the path that they saw Big Pharma on. And they felt like they could develop ways for the body to heal itself through nutrition. And that's when they set out to found Pharmanex. They have quite a facility out in Provo, Utah. It's a $150 million research and laboratory. And they actually spend about $60 million a year in research and development. The facility on the bottom right is their Asian facility. They have a presence over there as well. Stanford University used the scanner in a skin cancer study. The Yale Cancer Center did a 10-year prospective study on the scanner. Texas Tech University Medical School has 3 scanners in their clinic. I already talked about SUNY College of Optometry. This is Nobel Prize winning physics, been featured on the Dr. Oz show and the Discovery Channel. Pharmanex is the only supplement company that the U.S. Olympic Committee approved. And quite unusual is that their supplements are listed in the physician's desk reference. I'd also like to mention that Forbes listed them in their 100 most trustworthy companies. Let's talk a little bit about revenue. How does this work for a practice, and why does it work for a practice? Well, we know that, as we spoke about earlier, the healthcare system is getting turned upside down. You're going to have more and more Medicare folks that want to come in to see you, and Medicare is going to be paying less and less. So we need to capture revenue, where we can. There's really 2 components to revenue in our program. You've got testing, and then you've got therapy revenue. So let's talk about the testing first. Most practices charge $20. That seems about right for most markets. Some doctors charge more. Some doctors charge a little less. It really depends on what you feel fits into your practice. We recommend 20. Feels like a copay for most patients, and adds value, to your time and to your investment in the technology. So if you only scan 2 people a day at $20, you're going to, net about $10,000 per year in cash revenue. Again, no insurance denials or anything like that, which is great. Cash revenue is good. 5 patients a day. That's about where most of our offices are averaging, and that's going to add $25,000 in revenue. And of course, 10 would double that. And we have a few pretty high volume practices that are doing quite well with the scanner. Now, there's also therapy income, and there's lots of therapy or nutritional therapy products out there. One of the problems is retention, and that's what's really great about this program. Because of our testing and then our retesting, we tend to keep people on the products, versus some of the other options that are out there. If you look at a regular practice, an average practice has somewhere between 3,000 and 4,000 patient records. So just a small percentage of patients on kind of the flagship product that Pharmanex makes is going to have a nice income. And you can say, obviously, the more patients I have, the more income you're going to accrue. One of my favorite parts about this program is, rather than you stocking this product in your office, this is a direct ship program. So the patient actually signs up with Pharmanex. Pharmanex runs their credit card. Pharmanex ships direct to the patient. Pharmanex deals with the sales tax and shipping issues and all that kind of stuff. And then they pay monthly a commission to the practice based on volume of what gets recommended by you, basically. So really helps with overhead, stock, stuff in stock. Sometimes it expires, all that. You don't have to mess with that. So let's talk a little bit about the investment. To get a scanner, it's $33.95. That includes $2,500 worth of product. And that's intended for the doctors and staff at the practice to get a product experience. You could sell it. You could give it away as well. It's up to you to do with it, as you please. You're going to have 300 scans loaded onto your device. You'll have a personalized e-commerce store. You get attendance to our training session, which we hold monthly in Provo, Utah. We have, all kinds of providers, oncologists, functional medicine, chiropractors, optometrists, really, across the spectrum of healthcare attend. And it's a really, really neat event. And really what's most important here is the HCPN Alliance is the group of healthcare providers who know how to implement this device. And you're going to get our practice accelerator system. So this is not a program where we're going to give you a piece of equipment, show you how to turn it on, and then, see you later. You're going to get support on not only how to run the scans, but, talking points to, scripts for the patient, scripts for checkout, all the marketing materials you'll need to make it work in your office. And then there's just a nominal $120 a month maintenance fee, and that covers insurance, upgrades to the app, upgrades to the scanner. When the new device comes out or a new upgrade comes out, you just get a new one. You don't have to get stuck with an outdated piece of equipment, and also an additional 50 scans loaded on every month. So I'd like to bring in Dr. Jacob Olding. He's an optometrist in Ohio, Westerville, Ohio, and he has had a scanner now, I think, since November, and has been one of the really, great success stories for what we're doing. He's scanned hundreds of patients and has really got one of the fastest growing practices with the therapy. Jacob, are you online?
I am, Dr. Phelps. Thank you.
Well, thanks for joining us tonight, Dr. Olding. And just real quick, if you could tell us why you decided to put the scanner into your practice?
Sure. When I was introduced to the technology, right away, like most people, it kind of blows them away and surprises them that you can do this. So, when I sat back and thought about it, I'd been recommending nutritional products to patients for a while and talking about how important nutrition is with eye care, mostly AREDS type stuff. But, it's just one of those things that's difficult. At least I felt like it was difficult to gain any traction, selling it out of the office, things like that. So once I realized this type of technology was available that could measure what level of, nutritional protection my patients have, I just knew I needed to be able to have that and offer it to them. And then on top of that, the test is objective, only takes about 30 seconds, so it doesn't disrupt flow, and it was very inexpensive to both me and my patients.
Great. And now, do you have other cash pay tests that you run in your office? And did you feel like this would be a conflict with any of that?
I do. That was definitely one of the things I was very concerned about in the beginning, because I already had 2 cash pay options for my patients. So this was a third one, and I thought maybe they would feel like there's all these extra tests. But it really didn't. The practice didn't miss a beat. Patients still choose this one or that one or all of them. So in the end, it was really something I probably didn't need to worry about.
Great. And just some results, both financially and from a patient outcome standpoint. Do you have any good stories for us?
Yeah, I think, financially, I run about 4 to 5 scans a day, probably at $20 a piece. So I do what your recommendation at $20. I get typically between 50 and 70 scans a month. So, right away, I'm getting $1,000 to $1,400 a month just in scan fees. From the commission side on the supplements, that's just one of those things that slowly snowballs over time, because, my patients just get their new shipment sent next month. So that's something that has a lot of potential from a financial standpoint. From a clinical standpoint, it's been great. Obviously, just for your macular degeneration patients, to be able to prove to them and show them this is working and this is why, it's a pretty neat thing. But then even outside of that, just, you have a 35-year-old who scans poorly, doesn't have macular degeneration, or maybe isn't at risk for that at this point, but starting some of those patients on general supplements and having them come back and tell you how they feel better and have more energy, it's pretty special. I've had some neat conversations.
Great. Well, thank you very much. I'm confident that you're going to continue to improve patients' lives, with their awareness of their health, and making changes in their lifestyle, not only through supplementation, but through diet and exercise. And, I know you'll continue to reap the rewards financially. So I really appreciate your time tonight. Thank you very much, Dr. Olding.
Thanks, Dr. Phelps.
Okay, so I tried to go as fast as possible to keep it under 30 minutes for you guys, because I know your time is valuable. I just wanted to get all that information in. We liken this, we can make a difference. So, sometimes there's a storm and there's a bunch of starfish up on the beach, and, it would seem silly to throw 5 of them in when there's 1,000 of them. But, if we can just save 5% of your patients who might have gotten macular degeneration from getting it, or other heart disease, whatever it might be, I think it's worth it. So we want to test people, we want to treat them, and we want to track them. And that's what we believe the biophotonic scanner, can do. So as soon as this webinar is over, you're going to get redirected to a survey. Please take the survey if you would. If you'd like, you can schedule a personal phone consultation with me. My cell phone number is there on the screen, so I'll give you a second to write that down. Or If you feel more comfortable emailing me, my email address is there as well. And I would encourage you, if you are interested, to order as fast as possible. The sooner you get the scanner in place, the sooner we can train you and you can start generating that revenue from the scan fees and the therapy residuals. So thanks again for joining our webinar. Thanks, Dr. Olding, for joining us. Have a good evening, everybody.